Alzheimer's disease. The name Alzheimer's is originated in 1906 when a German physician, Dr. Alois Alzheimer, while performing brain autopsy, noted a collection of brain cell defectiveness as a disease. Today, this degenerative brain disorder bears his name, and when found during an autopsy, these twisted plaques and tangles mean a defined diagnosis of Alzheimer's disease. Alzheimer's disease is an irreversible progressive brain disease that destroys memory and thinking skills and eventually even destroys the ability to carry out the simplest tasks. Here is an explanation how Alzheimer's disease affects the brain. Inside of the normal healthy brain are billions of cells called neurons. The neurons are constantly communicating to one another, transmitting messages to each other as electrical charges. The electrical charges release chemical messengers called neuron transmitters, which travels across the synapses between neurons. They bind to the receptor sites, to the dendrites on the next neuron. The cellular circuit enables communication with the brain. Health neurons transmission is important for the brain to function well. Alzheimer's disease disrupts the circuit by compromising the ability of neurons to communicate with one another, destroying memory and thinking skills. Scientific research reveals some brain changes that take place in Alzheimer's disease. Abnormal structures called beta-amyloid plaques and neurons fibrillary tangles are classic biological marks of the disease. Neurons in certain brain regions get disconnected from each other and eventually die, causing memory loss. As this process continues, the brain shrinks and loses functions. Several drugs were approved to treat the cognitive symptoms of the disease, as the patients show deficiencies of acetylcholine and nerve growth factor. The drugs currently in use is treating only the symptoms, not the cause of the disorder, and used to treat, and the results so far have been modest. As we learn more, researchers are moving closer of discovering ways to treat and to prevent this devastating disease. Hi, my name is Annie, and now that you know more about Alzheimer's disease, I would like to introduce you to my daily and overwhelming life. This is Miss Joyce Cortina, and she's 87 years old. She used to be a very active person and is expert in solving crossword puzzles, right? She has been suffering from Alzheimer's disease since 2006, which has stolen her memories and thinking skills, as remembering names, words, recognizing people and places. Throughout this moving experience, I've learned that patience is the best key, instead of to be dealing with sedation. TLC, tender loving care, right?